Welcome to the Office Hours Quality Payment Program QPP conference call. My name is James. I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. During the Q&A session, if you have a question, please press *1 on your phone. I'd now like to turn the call over to Elena Smith. Elena, you may begin.
Hello, everyone. My name is Elena, and I'm a quality consultant with Lake Superior Quality Innovation Network, serving Minnesota, Michigan, and Wisconsin.
Elena?
Elena? Yeah.
Elena, this is James. Your audio just went very bad.
Oh. Can you hear me?
You're very garbled, like garble.
I don't know why that would have just started. Can you hear me better now?
No.
Let me pull you out of the meeting for a minute, see if I can talk to you privately.
Okay.
Mona, while he's trying to get her audio issues controlled, should we should we start to go through some of the other slides? Well, that's what I was wondering. Is I was pulling up the intro that she was reading to see if maybe we could do it, but I'm not there. If you're there, Candy, you can go ahead.
I'm not there yet, but I'm going there. So.
Yep. And this is Lisa. Welcome, everyone. I thought we could just have fun listening to Donald Duck talk for an hour.
Okay, Elena.
Is it sounding better now?
Oh, it's much better, yes.
Okay, good. I'm not sure why that happened, but thank you guys for letting me know. So, like I said, my name's Elena. I'm a quality consultant with Lake Superior Quality Innovation Network, servicing Michigan, Minnesota, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization Program. I would like to welcome you to this session of QPP Office Hours. Today's call will be operator assisted. By default, everyone's phones are currently muted to avoid background noise. Since this is an open office hours call, there will be opportunities to ask questions over the phone, at which time our operator, James, will provide instructions. We will also be closely monitoring the chat box and encourage you to post questions or comments throughout. Also, please note that the information provided during this session is based on the latest information made available by the Centers for Medicare and Medicaid Services and is subject to change. CMS policies do change, so we encourage you to review specific statutes and regulations that may apply to you for interpretation and update. Frequently, attendees have asked for links to the slides, so a link is available on the sign-in page of the WebEx. If you look over on the left-hand side, down at near the bottom, you can enter in a password, which is QPP, and a PDF file should show up. We'll also post a link to the slides in the chat box. At the end of the office hours, you'll have the opportunity to complete a brief evaluation. We would appreciate your feedback about this event and suggestions for future educational opportunities. We'd also like to remind those of you that receive direct technical assistance related to QPP to please take time to complete the evaluation sent at the conclusion of each technical assistance encounter. Your feedback is valuable and allows us to gauge how we are doing in regards to meeting your information needs in a timely and courteous manner. Also, I would like to mention that during the office hours calls, we typically can address a broad range of questions which are based on the equally broad range of MIPS knowledge level of all of our call participants. Some questions we'll be able to answer quickly. Others may require some additional time to research the complexity of the question, while others will be scenario-specific to your organization. Our team is implementing a new process to capture all of the Q&A presented during these calls. Questions that our team deems broad and applicable to all in our audience will be emailed to participants within 2 weeks of the event. Those that are scenario-specific, our team will address directly with the attendee via email and by phone. Finally, questions that require more research or those that appear frequently will be addressed at the next office hours. Today's objectives are that we will provide quality payment program updates and new resources for successful participation and reporting. We'll also summarize some important deadlines, and then, of course, we'll provide an opportunity for questions and answers. So getting into those important dates. So everyone knows that right now we're within the 2018 performance period reporting period. On March 22nd, the CMS web interface data submission closes. So you would know if you're within that CMS web interface data submission because you would have had to choose that you wanted to be a part of that. Most of you are probably submitting through the QPP portal with the merit-based incentive payment system, and that data submission closes on April 2nd, 2019 at 8 p.m. Eastern Time. You don't have to click submit or anything like that. You'll just want to make sure all of the data you want to be entered is entered, and then that system will close automatically and send all your information on CMS. On July 1st, 2019, your performance feedback will be available for the 2018 performance period. And then finally, on January 2nd, 2020, the performance year 2018 payment adjustments go into place. Today I'm going to be talking about the 2019 improvement activities category. I'm going to go over kind of the things that remained the same from last year and then also discuss some of the changes. So first I'm going to discuss those basics. So the weight to the final score for improvement activities is 15 MIPS percentage points. The minimum reporting period for the improvement activities category is 90 continuous days up to a year. You don't get any bonus points by doing the year-long reporting period. So you just want to pick a performance period that captures the improvement activities that you select. You also, for this category, can get up to 40 total points. So those 40 total points are what can get you 15 MIPS points. So if you get all 40 points within the improvement activities category, you will get 15 MIPS points. And you continue to report improvement activities by yes/no attestation. So what that means is you log into the QPP portal and you go into the improvement activities section and you search for your improvement activities that you selected, and you'll just click yes, I've completed it. You do want to keep some suggested documentation in case of an audit, and we do have on our LS2IM website a Excel sheet that shows some documented suggested documentation in case of an audit. So take a look at that, and once you find out what the suggested documentation is, we suggest putting that into a MIPS file on your computer. So scoring. So scoring remains the same for the improvement activities. So we have medium and high weighted improvement activities. The medium weighted activities are worth 10 points, and the high weighted activities are worth 20 points. So these are the ways that you'd be able to reach that 40 points. You can choose 2 high weighted activities, 1 high weighted activity, and 2 medium weighted activities, and then finally 4 medium weighted activities. There are a few exceptions to that. So there are special status scoring. So if you are a part of a patient-centered medical home, a Medicare Shared Savings Program, or a next-generation alternative payment model, you receive full credit within the improvement activities. So you'll log into the QPP portal, if it's the exact same as 2018, and you'll search patient-centered medical home, for example, and click that you're a part of a certified patient-centered medical home, and you'll get those full 40 improvement activity category points. You can receive 20 points or half credit if you're in any other type of APM. And then activities are double weighted for clinicians in small, underserved, or rural settings and non-patient facing clinicians or groups. So what that means is that for those clinicians, they receive 20 points for medium weighted activities and 40 points for high weighted activities. So they have to do kind of just pick half the amount of improvement activities. So improvement activities changes for 2019. There were 6 new improvement activities added, 5 activities were modified, and 1 activity was removed. So that leaves us with a total of 118 activities to choose from. The other change that occurred this year within the improvement activities category is that there will no longer be any bonus points for reporting activities via the electronic health record. So the new activities for improvement activities in 2019 are relationship-centered communication, financial navigation program, patient medication risk education, use of the Centers for Disease Control and Prevention guidelines for clinical decision support to prescribe opioids for chronic pain via clinical decision support, comprehensive eye exam, and completion of collaborative care management training programs. So if you're looking for some new improvement activities to implement in your practice, definitely take a look at the QPP website and look through the improvement activities list for 2019 and find out the details on some of these and see if those would be some improvement activities that you could maybe implement in your practice this year. Now, for those of you that reported for 2018, there were some improvement activities that were modified. They include chronic care and preventative care management for empaneled patients, care transition documentation practice improvements, participation in maintenance of certification, or MOC Part 4, use of patient safety tools, and implementation of analytic capabilities to manage total cost of care for practice populations. So if in 2018 you chose...
Elena, your connection just went bad again.
Oh my goodness. Can you hear me? Is it better now?
No, it's not.
I'm not sure.
Let me pull you out again. Maybe that'll fix you. I'll be right.
And we can actually continue. I don't know if Candy, if you're comfortable continuing with the slides, and I'll continue in the chat.
Hang on a second. Okay, so we're on slide 10.
Yep.
And so the modified and so is Elena back in? Nope. Okay, so modified improvement activities for 2019 are chronic care and preventative care management for empaneled patients, care transition documentation practice improvements, participation in maintenance of certification, Part 4, use of patient safety tools, and implementation of analytic capabilities to manage total cost of care for a practice population. Next slide.
I think Elena has the slides.
Yeah, if we could, Emily from WebEx, can you give Candy Hansen control of the slides? Well, we may not have control of them.
This is James again. We do have Emily still in.
So she can just push the slides forward.
Yeah, if somebody could
Emily,
push this.
Sure. Emily, can you just go to the next slide, please?
Oh, I'll be right back.
All right. Or if Elena can, that's fine too.
Yeah. So sorry for the technical difficulties we're having today, folks. We appreciate
the next slide's up, isn't it? Nope, it's the same one.
Oh.
Okay. You know, just while we're sitting here to make maybe good use of the time, one of the common questions I get on improvement activities is whether or not improvement activities can be done the same one in subsequent years. And the answer to that is that if the improvement activity does not specify that you cannot do them in 2 years in a row, or if they say you can only do it every 5 years, you can do the same improvement activity 2 years in a row.
Thank you, Mona. Can you hear me better now?
Yeah.
Yep, we can hear you.
Great. All right. So
if that, Elena, if that happens again, I think we want you just to advance the slides for us while you're, I don't know if you can do multitask.
Oh, absolutely. Yeah, sorry. Okay, so
we did this slide.
Okay, great. So the removed improvement activity for 2019, CMS felt that these two, which actually have the exact same title, participation in population health research, could actually fall under just one of these. So the one that they selected to remove is IA_PM_9. So if you chose that one in previous years, I would suggest going in and looking at each of the improvement activities, finding the other participation in population health research, IAPM 17, and making sure that you're still meeting those requirements. So the last thing that I want to talk about is 2018 QPP reporting, since the reporting period will be closing soon. So just some final reminders. Again, as I mentioned, 2018 attestation period ends on April 2nd, 2019 at 8 p.m. Eastern Time. You do need 15 points to avoid penalty. So you need 15 points to reach that neutral payment adjustment. And as we mentioned before, the improvement activity category is worth 15 percentage points. So if you maybe haven't started reporting yet, or maybe you weren't tracking your quality measures, or you don't have an EHR, the improvement activity category is a great way this year for 2018 to get those 15 points that you need to avoid the negative payment adjustment. For 2019, that's not going to be the same, because in 2019, for this year, you need 30 total MIPS points to avoid the negative payment adjustment. So we highly suggest to make sure that you either are tracking your quality measures, or you have that EHR and have it certified for 2015, and you're meeting all the requirements for those to make sure you're able to reach those 30 points. If that's something that's new for you, or you're confused about any of the new requirements for quality or promoting interoperability, feel free to give your state representative a call or email, and we can definitely assist you to make sure you're successful in 2019 so that you can reach or exceed, or both, that 30-point threshold. That is all that I have today. So we can start that question and answer section. Do we have any that need to be discussed in the chat?
Yes, there is one in the chat that is in reference to PTs and OTs, that none of the EHR software companies that are specifically been designed for PTs and OTs are certified. The vendors are saying they are working with CMS to get them certified, but there looks like from the person who's writing this that the requirement of drug-to-drug and allergy drug formulas are not part of the PT-OT software, and just asking if we've heard about anything on this. And I would put that out to all of our subject matter experts that are on the line.
You know, that's a great question, and one that we thought of back in Meaningful Use, you know, if they ever brought other providers on. But I'm thinking, and, you know, I don't think that we have clarification from CMS on this particular fact that PTs and OTs aren't using. And I'm wondering if they may not have an exclusion for that, like chiropractors would.
Well, and also the PTs and OTs they can get automatically reweighted in the PI category, right?
Correct.
Yeah.
So they are eligible for automatic reweighting into the quality category.
Mm-hmm.
So there's two pieces of that we need further clarification, I know, because the thing is if they're not using certified EHRs, then they'd have to reweight. If they are using a certified EHR, then they may, and we need to clarify this with CMS, I would assume that CMS would put some sort of exclusion in there.
Right, and then if you are part of an ACO, they have to submit data for the PTs and OTs. Lisa, any insight on that?
I would think it would be the same. You just don't include them if they don't have the applicable measures like they would for quality, because many of those PTs and OTs, if they don't have those patient bases for those measures, they're not going to be included. So I think if they aren't included, they don't have a denominator.
That's my understanding as well.
So if they don't do the activity, they have a zero denominator.
Right.
But if they do the activity, they would include those activities that these PTs and OTs would do in the EHR, if they have a certified EHR.
But that's pretty problematic for those that don't have EHRs that aren't certified yet.
Yes. It just takes them out of the picture of getting a score there.
I think we'll still need maybe James to set up that call-in portion.
Yes, because there are no more questions in chat, so yeah, go ahead.
Yeah.
Okay, we can be in our audio phone question and answer session. If you have a question, please press *1 on your phone. If you wish to be removed from the question queue, press the # sign or the # key. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, press *1. Our first question is from Rainey Carey.
Hi, this is Randy Carey, and I'm the one who asked the question about the PTOT, and this all has to do with the certified EHR. So we belong to an ACO, and therefore we have to include all of our providers in that, assuming that they're on a certified EHR. So we've met with all of our vendors that have PTOT, all the EHR vendors, and they're all like, well, we're excluded. And I said, no, you're not excluded, and you have to have certified EHR. No, we don't have to have certified EHR. Well, yes, you do. And they said, well, we don't do anything to do with drugs, so therefore we're never going to get certified. And every PT vendor has said the same thing. And so it's very frustrating because CMS says, well, include all these PTs, OTs, only there's not one PT-OT software that's certified. And so, CMS needs to get word that there is no software that's certified for these people, and you want us to include them when we do the ACOs. I can't. They're not certified EHRs. So
that's a great point. And I thank you for bringing that up. This is Lisa at Stratus Health, and I was talking to physical therapists, and they do their own quality measures, and they do their own charting and their own things, but where they're lacking is in the cost category, and are they turning their quality measures in? So they're not turning their quality measures in, and I think that's what CMS is looking for, is a cost
quality
control
measures don't necessarily come out of the certified EHR. You could send them from a registry. But the PI piece has to come out of your certified EHR.
Well, actually, your quality measures do, too.
No, they can come out of a qualified registry.
Qualified registry, yeah.
So they don't have to come out. And we've said to every one of them, you don't have to do that out of your certified, but your PI you do. But there's no certified registries no certified EHRs out there for PTs or OTs.
Yeah, and what I'm saying is that they're going to miss out on that 15% of the score, and probably they'll need to do really well in the other categories to make up their total MIPS score without a certified EHR.
Well, it's 25%, not 15%.
25%, correct. Sorry.
25% for PI.
Yeah. And that, we don't know what that'll be next year, but, that's going to probably go down. We don't know. And interoperability is a big push by CMS, and I think they're going to say to those PTs and OT, too bad, so sad, we need interoperability. And they either have a lower MIPS score or they, connect. In my opinion, I don't know what CMS will do.
And when you belong to an ACO, that's difficult because all you submit data for an ACO is the PI portion. The ACO submits the quality and the process improvement.
Yeah, in fact, that's going to change this year. You don't even need to, depending on the ACO you're on. You don't even need to submit for MSSP.
You don't need to submit what?
PI.
For 2019?
Nope.
Yes. Can you all verify that? My subject matter expert here.
They have changed the criteria for MSSPs that for 2019 you do not have to go into MIPS and do the PI category as you have done the last 2 years. They are going to evaluate whether or not 50% of the clinicians in the ACO are using the certified EHR by, I think it's the attestation of the ACO.
I believe so, or it would be written in their contract.
Right.
I don't think that's for 2019. The direction we have always been given, if you're a MIPS APM, which is a Medical Shared Savings 1, you do have to submit PI. If you're an advanced alternative payment model, you have to submit PI. However, it's not going to be scored. It's just going to be used for the 50% thing.
Yeah, for the MIPS APM, Randy, I am not sure. What I just said is directly related. I know that for sure on the QPs in an advanced APM.
Yep, that's what I understand as well. This is Lisa.
Yeah, let's go ahead and verify that in writing from a CMS source, and we'll put it in our Q&As.
And then I do have one other question since I got you on the phone, and it's related to the other thing. For the improvement activities, you said you could do those 2 years in a row. I know of no requirement that at this point in time that you can't do those forever. I mean, not just 2 years, because we're on our third year. So if we can't do that this year, that's we need to know that.
Unless specifically said in the improvement activity, there are no limitations of how often you do them, other than you can only claim an improvement activity once in a performance year.
So there are some like courses that are available that they won't let you do every single year, for example.
Right. Yeah.
But most of the other ones, yes, you could repeat in 2018 and then do the same one in 2019 and 2020 as of right now.
Okay.
In the final rule, the only thing that they say in there is you can't claim the same one for 2 90-day periods within the same year, which makes sense.
Mm-hmm.
Okay.
Once again, if you have a question, press star 1. Looks like we have no more questions.
Okay. Can give it a few more minutes. Do we have any other topics we want to talk about regarding reporting or anything like that? Anyone on the call?
I think we just want to emphasize, Elena, that what you had mentioned already, that the points go up to 30 for 2019. And if you don't have a lot of experience with MIPS so far, and getting to 15 was, challenging, getting to 30 is going to be more challenging. So you just really want to be, as soon as you're done reporting for 2018, if you haven't already started, get going on 2019 so you have a large enough denominator to meet your data completeness thresholds.
Yeah, this is Mona, and the other thing that I would ask the audience is just, has anybody had any issue with getting their reporting done that they're stuck on, or a lesson learned that they could share with the audience today? Not hearing anything. Does that mean all the reporting has gone really smoothly? We do have a question. We have Greenway and their reports are not working. And I have some other folks that have made that comment. And the Greenway is supposed to be working on that. I don't know if any of the other subject matter experts have any other insight.
That's the last I heard as well. I heard this once, and the last I heard is Greenaway is working on it, and they think they will have their issue resolved soon, but that was earlier this week.
There's another... Oh, go ahead.
We have a couple questioners.
Okay, go ahead.
First is from Don.
Hi, this is Don with Healthies. Yeah, we are having an issue that we're still trying to work through, and that's namely we have providers that are in ACO that are in our ACO. We also have a few of them that didn't make it, so we need to attest for them as a separate group. So the biggest challenge there is just getting the ECQM file for that smaller group of about 70 providers, because our system doesn't seem to be able to lump it into one group of 70. So I think we may have to do some manual calculations and manual entry in the straight MIPS portion of the attestation. So that's kind of our biggest challenge at the moment.
So Don, what is the issue with uploading the file to the QPP portal?
Well, the problem we're having is we can't lump sum these 70 providers and their numerators and denominators into one small group of 70 providers. We can only generate a QRDA3 file per individual provider. We can't somehow create a QRDA3 file for all 70 and have one combined value for each numerator and denominator. So
oh boy, that's
I think that's in your reporting capacities and might be something to look at for future years, because I don't know that that's going to change a whole lot.
Functionality-wise, probably not, but yeah, it'd be a very manual process. And one more conversation with our vendor to see if that's truly what we're going to have to do, but basically that's what CMS has recommended us.
I think that's a vendor conversation. I really do.
Yep. That's kind of
I know that others have had the same issue, and they have to go back to their vendor and discuss that and say, you know what, you got to make this easier for us.
Yeah. So we're hoping to have that conversation tomorrow.
Good.
Well, our sympathies are with you, Don. That's a royal pain.
Yep.
Yeah, they should be doing what they should be doing for CMS. I mean, it shouldn't be your issue. It should be the vendor's issue.
Okay. We'll see what they say tomorrow.
We do have one question in chat about Credible. The EHR, it says, we have Credible, and I am also struggling with CQM working. Anybody else? Anybody have any knowledge on that?
I had one clinic last year or 2 years ago that used Credible, and it was in a behavioral health clinic, and they were having issues, but I can't speak to exactly what those issues are other than just meeting meaningful use.
So the person in chat, I don't know if you want to get in the phone queue to, give us a little more information, or contact your state representative here and talk it through to see if there's anything we can help you with. Is there anyone else on the phone?
I'm sorry. We have Rainey Terry with a question.
I do not have a question.
Oh,
okay.
Sorry.
This is Lisa, and I just want to, from Stratus Health, and with these questions regarding EHRs, I think we need to kind of just step back and say anything with your EHR and report really is a vendor issue and must be, addressed as such with the vendors. But thank you for bringing these to our attention. It's nice to know on these calls, what the issues are, especially when it affects many others.
And once again, if you have a question or comment, star 1 on your phone. And there are no questions on the phone.
Okay, well, we'll give everyone a couple more minutes if you want to ask any more questions in the chat or get on that phone queue. And I just want to thank everyone for joining us today. And we do ask that you please take a moment to complete the brief evaluation that will appear when you close out of the webinar. Your feedback is much appreciated and is used to inform our future educational offerings and resource development. Today, you will automatically be redirected to an evaluation, and we, again, ask that you take a moment to complete that.
Elena, I do not have anything else in chat.
Okay. And James, are there any other people waiting in the phone queue?
No questions over the phone.
Okay, well, I think that we can close out of this month's QPP office hours. If you have any questions that you didn't ask or weren't answered during today's office hours, feel free to reach out to your state representative. And thank you again for joining us.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.